been working with the state for the last few months on planning for our COVID vaccination distribution and implementation, yes.
Sure.
So I was well aware of all I was really appreciative actually of the press conference, because it just validates and verifies what we're messaging as well.
How is that going, planning some of, how you guys are going to distribute the vaccines once available?
Correct. Yes, the flu campaign was our practice platform for doing COVID vaccine. It's worked really well. We've done some time studies. We know how many people we can accommodate in a certain time frame with certain staff. And that's been very, very helpful. We've tested drive-through different areas. It's really worked well.
For essential workers getting the vaccine first, does that also apply to their immediate family members as well? Would they also be getting the vaccine?
No, not yet. It would be only the healthcare workers. The top tier is the hospital workers who are frontline, which means that they are working with COVID patients or suspect COVID patients directly, or like laboratory, working with specimens, or vaccinating. We're going to have to vaccinate our vaccinators first. So those are the individuals, and it doesn't include family quite yet.
Would you mind going a little bit more in depth on who would be in that most vulnerable category? For example, if you have somebody who is 65 plus, but they may not have any underlying health conditions, would that still apply to them, or how does that work?
When we get to that tier, yes. Those who are over 65 and or have medical conditions. So we wouldn't differentiate between the two. We would just invite them all at one particular clinic or pod, we call them, or mass vaccination clinics. Yes.
Okay. And, the vaccine is not mandatory. If you don't want to take it, can your workplace mandate that?
Well, you know what? I'm just the vaccine manager and program manager, so I really wouldn't, really couldn't say to that. However, I mean, some healthcare workers do have mandatory vaccinations, such as tetanus shots, measles shots, all of those types of things. So certainly employers can require that for certain workers based on risk. So it's really unknown at this point what employers will plan to do.
Sure. And do you think the COVID-19 vaccine is going to become one of those, staple vaccinations, I guess, if you will, like tetanus or things like that?
It would depend on the pandemic. I certainly think in the next few years it would be, but unless we get everyone vaccinated and we're until we know that, then it's hard to say whether it's going to be a routine vaccination or not.
What is the Southern Nevada Health District going to do to get the general public on board? And what is your response to those people who don't want it?
Right. So what I usually tell individuals is that the vaccine has been going through the same process, shorter certainly, but still going through the same process as other vaccines. And they'll deem it, safe, and it certainly seems effective. When people say, well, I don't want to do vaccines, they're afraid for different reasons. Sometimes we work with families and try to educate them and the risk versus the benefits. But certainly, as the vaccine is rolling out and coming forward, we will be messaging those factors of the vaccine, but certainly we're going to just start immunizing those who want it, and then there'll be some campaign with vaccine hesitancy.
Oh, I see.
So who World Health Organization has addressed this vaccine hesitancy issue, and there are different why people don't want the vaccine. So it comes from a higher level.
I see. And from your standpoint, do you see that hesitancy here in Southern Nevada at all?
Well, vaccine hesitancy, I would say that it's probably less here in Southern Nevada than maybe in other areas. And certainly there's a lot of parents or individuals may not want a certain vaccine. It's not that they're against all vaccines, it's just certain ones. So we address that as we can, talking with parents, but certainly there'll be plenty of work for us to do, just getting the vaccine into the arms of those who want it.
People aren't getting the vaccine. How does that impact our fight against this pandemic? Does it have an impact?
Yeah, certainly. I mean, the more people that have the vaccine, the less risk that there will be COVID in the population. So at this point, it's unknown what that would be until we get some more data. And they're constantly collecting data and looking at it and analyzing, but it takes a lot of time and resources to do that. So at this point, we don't know, but certainly looking at other vaccines that we experience with other vaccines, there certainly it would need to be at a higher level than, at least half.
Some people are frustrated a bit that the general public is kind of that last tier and may not get it until spring. I think a lot of people are feeling frustrations with just being locked in all the time. So could you maybe talk a little bit more about the process or the importance of why we're doing this tiered approach?
Correct. So it's been analyzed. They've been looking at this for quite some time. And we've heard things from the last 6 months on how this would work. And with any vaccine, we look, when a new vaccine comes out, they always look at the epidemiology and they look at the data, who is at the most risk. For example, HPV. We started with 11 to 12-year-old girls, okay? And then what boys were added. So it's with any vaccine that occurs. So they look at those with the highest risk and death and who is at most at dying first, okay? So those would be individuals that are in the nursing homes and long-term care, hospitals, and then we also need to protect our workforce. So who is at the most risk and what workforce do we really, really need at this point? And that's why hospital employees were targeted and long-term care employees and our infrastructure. So that's how that all gets figured out. And certainly I think, it's going to take us time to immunize 1 million people. Think about how long it took to test 1 million people. So, it's going to take some time and people will need to be patient. It depends on the vaccine uptake. Certainly, if not everybody wants the vaccine, we'll be able to move through those tiers really quick. And we do plan to do that. We are, whoops, oh, there we are. It went into sleep mode. We are planning, to move through the tiers fairly quickly, and eventually the general public will be getting that. I would anticipate certainly spring. I think to keep in mind the indications and the whole specifics of who gets the vaccine hasn't quite been solidified yet by ACIP. For example, it wasn't tested on kids, wasn't tested on pregnant women. So they will have to decide if there's enough data, whether that would be safe or not.
Would you mind explaining ACIP?
Advisory Committee on Immunization Practices. So that is a committee that is formed with CDC, and they have been a long-standing committee for many, many years. I've been in vaccine for 30 years, so we've always gone according to ACIP recommendations. And what they do is they look at all the research, all the data, and they decide what indicate who gets it, how it's given, the intervals between, and they look at a lot of epidemiological data. So they give recommendations. They're not rules, they're recommendations. And then we, as health departments, take those recommendations, and as well as physicians and all health personnel, we look at those recommendations and we incorporate that into our orders or how we practice. So it's really important to us for ACIP to approve it. We don't give vaccine unless they have solid recommendations for us.
I see. And
so
they haven't given that stamp of approval yet.
No, they had a meeting this week, and they looked at indications. I listened to part of it, and it seems like they're aligning, fairly well with what Nevada is talking about doing and what we're planning on doing. So, but they still need to see the data regarding the vaccine in particular, how it's given, how do you dilute it, all those little minor detail, or not minor, but specific details that we're going to need to give the vaccine.
As more and more people, those top tiers, are getting vaccinated, do you foresee any changes to some of these mandates or restrictions as we go through this process?
It's unknown at this point. I think it depends on how much vaccine uptake there is. If we, I think I'm sure we're going to need to wear masks for a while. I know people don't want to hear that. My family is like, really, Mom? I go, yes, just do it. And we need to get kids back in school. And so, that's teachers are on, tier 2. So until all that happens, and it's gonna be a while for us to get that vaccine out. We will be working very hard to get that done. And I have an excellent immunization team, and I can't say enough about them. And the state has been very, very supportive. So we're all working together and to roll the vaccine out.
When it comes to nursing homes and some of the elderly that would be vaccinated, would their family need to sign off on that vaccine, or how is that going to work?
Well, that depends. Some residents of nursing homes, I worked in a nursing home for a short time. Some individuals have a healthcare power of attorney, and would that person and they have to sign off on all these consents and things, all of the care for the person. And then some people have their own, so it just depends. And it does kind of set up a barrier, but the nursing staff at those places, they know how to do that. And they certainly will be, families will need to decide what to do, and they should start thinking about that. And there is information on CDC about it. For healthcare professionals, I just saw a notice today from Children's Hospital of Philadelphia, which is really a good they have a really good vaccine center information, and Dr. Offit has some videos on vaccine. So that's very helpful. So they really should start thinking about that right now, and look at the websites and determine whether that's something that they want for their family member.
Great. And anything else that you want to add? Anything I didn't ask about that you think is important to get across as we're working through this vaccine process?
Right. I think individuals really need to start thinking about what they want to do and whether they want to get vaccinated or not. And there are many reasons why they would or would not, but certainly the healthcare workers and those who are frontline testing people in the lab, I really would encourage them to get the vaccine. I personally, I'm really excited about it. I have to say, I have decided to do so. So I would encourage people to start thinking about it, because it's coming up quick.